Good morning, my name is Latasha Jones. I'm a student with the College of Central Florida, and today I'm going to do trach care. Before I go into the patient's room, I verify the physician's orders, so I'm going to have the right patient doing the right procedure. You can come along with me. I'm going to knock on the patient's door as I enter. I'm going to close the curtain behind me. The patient's supplies are already in the room. I'm going to go ahead and wash my hands before I touch the patient. Good morning, Ms. Jones. My name is Latasha. Can you tell me your name and date of birth? If the patient was able to speak and tell me her name and date of birth, I'll compare it with my doctor's orders. If not, I'll look at the patient's ID, compare the name and date of birth with my physician's orders, and they do match. Ms. Jones, today your physician ordered for me to do trach care. What that means is I'm just going to take the old dressing from around your trach site, put a new one on, clean the surrounding skin before I put the new one on, take the old ties from around your neck, put some new ones on, take the inner cannula, which you may know as a tube that's inside maintaining your airway, clean that out and put it back in. During this procedure, if you feel like you're in any distress, raise either one of your hands and I'll stop and see what's going on with you. Before I complete the skill, I've already done my respiratory assessment. I've listened to the patient's lung sounds, anterior and posterior. She's cleared. She doesn't have any crackles, any wheezings, no need to suction or anything like that. Her lungs are even and symmetrical. She doesn't have any cyanosis. Her capillary refill is brisk, and she's breathing unlabored. She doesn't have any distress, so I can go ahead and proceed. Now, normally for this procedure, you would have on PPE, which consists of a gown and a face eye shield, mask with a face with a shield. I'm not going to have it for the purposes of this video, but I do need to come over here and grab a trash so that I can pour my supplies in. I'm just going to kind of have that kind of right down here. I wash my hands again since I just touched the trash. I'm going to lift your bed up so I can go ahead and get started. And all of my supplies are in here. Lift your head up a little. There we go. I'm going to go ahead and remove the pillow just in case I have to hyperextend your neck. Wash my hands before I open my supplies. I have my half peroxide, which it's brand new. The expiration date is March 2017. It's really good. It's good to go. I have my normal saline here. It's unopened. It's brand new. Expiration date is March 2017. No, it's clear, not cloudy, so it can be used. I have an extra set of sterile gloves just in case I need them. I'm going to put them over here. Got my clean gloves. I'm going to go ahead and put these on. Going to go ahead and cover the patient up. Just put this Chuck's pass just so we can add some protection. Go ahead and remove the patient's airway, but I'm going to kind of keep it close since this is not going to be attached during this procedure. So I'm going to keep it nearby just in case I need it. I'm going to go ahead at this point, take off the old dressing, and I'm going to go ahead and look at the color, the odor, see if there's any odor to it, check the amount. Just look for my COCA, which is the color, the odor, the consistency, and the amount, and I'll be sure to document my findings. I'm going to go ahead and discard these old gloves. Put some sanitizer on my hand and begin to prepare my sterile fill and open up my supplies. Open this. Now with this drape, this is going to be my sterile fill. Sterile can touch sterile. White, shiny side down. The shiny side is facing me. And I'm going to put it down. I have a 1-inch border. I'm going to come touch my border. I'm going to come dump my supplies. I'm going to go ahead and pour my half peroxide. Since this is going to be my drying compartment, so I'm going to put my half peroxide here in the first one. And I'm gonna go ahead and put my normal saline in a second. I'm gonna go ahead and don my sterile gloves. Well, look at this, can't use that. So at this point, I would put on my other sterile gloves. I'll get a new pair of sterile gloves. I would open. That 1-inch border. Put on my dominant hand first, and I fix that once I put on the other pair. Sterile can touch sterile. Now that I'm all sterile, I can clean both up. And I'll just go ahead and discard that. Now, I know this is pretty close, but I'm still protected and I'm still sterile. So at this point, I'll go ahead and set up my field. This is going to be my venetrated drape. Go ahead and take a Q-tip and put one in the peroxide and one in the saline, so they're not touching anything. Since I'm sterile, I'll go ahead and take out my inner cannula. And I'm going to step around, take out this is the peroxide. With my sterile hand, I'm going to take out the peroxide Q-tip and place the inner cannula in there. And I'm going to go ahead and clean around the site. Now, this is my non-dominant hand, so now I would use this as my non-sterile hand. So I'm just going to gently clean around the stoma, making sure I'm going from the inner to outer. And I'm doing so. Getting any secretions. Trash that. Take my saline. And wiping the areas where the peroxide was. Inner to outer. And I'll trash that. Now, with my non-sterile hand, I'm going to go ahead and come over here. I'll first kind of move these away from my sterile field. And I'll go inside the peroxide. Kind of swish these around, and I'm going to take the pipe cleaner. This is sterile. Stepping away from my sterile field, I'm going to go ahead and clean this with the pipe cleaner, getting out any secretions. Going to throw the pipe away once it's done. This is my sterile hand. I'm going to keep it up just so I keep it sterile. Put this in my saline, kind of splash it around to get that peroxide off. I'm gonna come over here with my sterile hand, gonna grab the gauze and dry it so I can insert it back into the patient. And I'll just still sterile. Now, I'm going to take another one with my sterile hand. And I'm gonna go ahead and insert it into, this is my sterile hand, so I'm still sterile. My dominant hand, I'm going to go ahead and put it in back into the patient's airway. I'm going to start at 9 o'clock and go to 6 o'clock. And I'm going to keep inserting until I hear a click. And I just heard that click, which is fine. So now I have to put the old dressing around the site. Now, with my sterile hand, I'm going to take these, put them into my non-sterile hand and kind of use, now I kind of have two sterile hands here. I'm going to take the most important part of this is it's the lining that's gonna be around the patient. So I'm gonna try to do this, make this as sterile as possible, protecting that lining. Gonna try to lay that, take How you doing, Miss Jones? You're doing pretty good? Good. Throughout the whole procedure, I'm continuing to monitor her. Okay. And it's secured around, and the inside was still sterile. Okay. Now, lastly, I have to change the ties. For the purposes of the video, I will not change the ties. But when in the real world, when I'm changing the ties, I will make sure that the old ties is left in place and secure until the new ties are placed and secure. Once the new ties are placed, I'll make sure that I have about 1 to 2 finger width in between. Then I'll take the old ties away. When I tie my knots, because these are the knotted ties, when I'm tying them, I'll be sure to make sure that I place the knot as closest to the patient's neck, the front of the neck as possible, and avoid that main carotid artery. So as again, I'm gonna leave these on just for the purposes of the video. How are you doing, Miss Jones? How are you doing? You're doing pretty good? Good. Now, since everything is all done, I'm gonna go ahead and put the airway back on. Put her oxygen back on. Clean her up. Take out all of my supplies. I'll take off these sterile gloves at this point. Take all of my supplies. I'll pour my saline and everything in the sink. Go ahead and put the bed down. Can I get you anything, Miss Jones? Okay, she shook her head no. Gonna put the bed down. I'm gonna lay the side rails up. Bed is locked and low. Put it in the lowest position. Put your pillow back under your neck. Your call light is right here. If you need anything, call me. I'm going to put your head of the bed down a little bit, but I'll come back and check on you in about 15 minutes. After I've done this procedure, before I leave the room, I'll make sure I do my second and last respiratory assessment. She doesn't have any distress. I've checked her O2 stats, her respirations, color's good, everything's fine. Clean up my equipment. For the purposes of the video, I'll leave it here. Before I go out the patient's room, I'll wash my hands, open up the curtain. Can I get you anything else, Miss Jones? She's fine. As I'm leaving the patient's room, I'll be sure to document my procedure and my findings for the drainage. Thank you.